Okay, welcome back. So today we are going to talk about the development of heart. So where to start? So the development of the heart begins by 16th day, and heartbeat begins by fourth week. Fourth week. That is 22nd day. Okay, and during the development of the heart, initially we are actually having two heart tubes. Yeah, they are also called as primitive heart tubes or endothelial heart tubes. These primitive heart tubes formed in splanchnopluric lateral plate mesoderm. We had already talked this in previous video. Here you can see splanchnopluric lateral plate mesoderm forms cardiac jelly and which forms endocardial cushion, and myoepicardial mantle which forms myocardiac muscle and visceral layer of serous pericardium. Cardiac muscle in turn nothing but heart. So heart is developing from splanchnopluric lateral plate mesoderm. So let's come here. Yeah. So these primitive heart tubes formed in splanchnopluric lateral plate mesoderm. And here you can see these are endothelial heart tubes, two endothelial heart tubes. And these are going to fuse cranially. Cranially, in the sense this is cranial, this is caudal. Caudal end, cranial end. So in the cranial end, they got fused. Now they form three dilatations. I'll show you the three dilatations here. So this is the diagram. After fusing, this is cranial end, this is caudal end, and from the cranial end, blood goes out. From the caudal end, blood runs in. That is, blood enters from here, blood leaves from here. So these three dilatations formed here. So first is bulbus cordis, primitive ventricle, primitive atrium. So we'll talk about these three. And first of all, I want to talk about these diagrams. See, so we are looking at right atria here and right ventricle here. So in right atria, the walls, we are talking about the right atria walls. So inside atria, there is rough anterior wall and smooth posterior wall. This wall is smooth, which is posterior, and this, which we can see this is rough anterior wall. As well, like in this right ventricle diagram, you can see the inflow is rough wall. Rough. Can you see the rough wall? And the outflow, can you see this is smooth? Outflow is smooth. Why? Because outflow should be smooth to not to have trouble over sending out. And from here, you can see the pulmonary trunk and ascending aorta. Okay, and I'll tell you how these came, like how smooth wall came, how rough wall came here, how inflow is rough wall here, how outflow is smooth wall here, from where they came, like the smooth wall, from where it came. We'll talk about it here. So in bulbus cordis is divided into three parts, that is truncus arteriosus and conus and proximal 1/3, because it is proximal 1/3. And can you see the conus here? So the conus forms the smooth outflowing part of right ventricle and left ventricle, and proximal 1/3 forms a rough inflowing part of right ventricle. As well, like primitive ventricle also, you can see in primitive ventricle, it forms rough inflowing part of the left ventricle. Inflowing part is rough here also. And primitive atrium, this forms a rough anterior wall of both right atria and left atria. Forms a rough anterior wall. And in sinus venosus, this end is called sinus venosus, and this have two horns. There's a right horn, there is a left horn. From this right horn of sinus venosus, there is formation of smooth posterior wall of right atria. So all the smooth and rough walls we got, except the smooth posterior wall of left atria. Smooth posterior wall of left atria we didn't get. We will see this further, like here. So first of all, I'll tell you an example. So think our entire CVS is divided into three parts: I'm telling all these things to make it easy for you. So think our entire CVS is divided into 3 parts: inflow, pump, and outflow. Inflow, pump, and outflow. So from upper half of the body, blood collected by superior vena cava. From lower half of the body, blood collected by inferior vena cava. From lungs, blood is collected by pulmonary veins. From heart, blood is collected by coronary sinus. So inflow, what happens is, to the heart, the inflow of the blood will be from superior vena cava, inferior vena cava, pulmonary veins, and coronary sinus. And heart is like a pump, and heart gives the blood out, like it flows the blood out. So the blood out will be through aorta, ascending aorta, arch of aorta, and descending aorta, that is aorta and pulmonary trunk, where there is the right and left pulmonary arteries. So you got the outline, right? From here you can get the outline, like you can match with the next coming topics. So for example, think this is your developing heart. So this is your developing heart, and this is left atria, and there you can see pulmonary vein. So we can enlarge this into here. This is left atria, pulmonary vein. So first of all, left atria is giving pulmonary veins, and it itself giving 4 pulmonary veins. Later on in development, what's happening is, in the middle trunk part, this is the middle trunk part, you can see this is the middle trunk part, it is again absorbed back into the wall of left atria. This will come like this, it is absorbed back into the left atria. This itself is forming smooth wall of left atria. See, it became the smooth wall of left atria. So here pulmonary veins derived from left atria, and smooth posterior wall of left atria is derived from absorbed part of pulmonary veins. From where? It is from the absorbed part of pulmonary veins. Okay, and you can also see here, this part is truncus arteriosus. This truncus arteriosus, from here ascending aorta and pulmonary trunk derived from here. So you see here, so this is the same diagram, and we can zoom in this truncus arteriosus part. You can see this is the top view, and this half is ascending aorta, this is pulmonary trunk, and in between them there is a septum, that is aorticopulmonary septum, also known as spiral septum. And the spiral septum is derived from neural crest cells. So why spinal septum? Can anyone say? If anyone knows, please comment, and I'll tell you about the spiral septum formation. So what is it? The spiral septum is a structure that divides the truncus arteriosus into the aorta and pulmonary trunk. And how is it formed? These neural crest cells migrate to the truncus arteriosus and bulbus cordis to form the ridges. These ridges spiral around each other. And fuse in the midline to form spiral septum. So these ridges spiral around each other and fuse in the midline to form the spiral septum. Why is it so important? It ensures proper blood flow. This ensures proper blood flow. The aorta connects to the left ventricle, carrying the oxygenated blood to the body, and the pulmonary trunk connects to the right ventricle, carrying deoxygenated blood to the lungs. So you can see some abnormalities here itself. For example, if spiral septum doesn't spiral, then aorta from right ventricle, pulmonary trunk from left ventricle, these get transposition. So non-spiral of spiral septum leads to transposition of great vessels. This is first abnormality. And absence of spiral septum is itself absent. It leads to patent truncus arteriosus. I guess you guys heard this so many times. This patent truncus arteriosus, where ascending aorta and pulmonary trunk are not divided at all. And the third one is, if there is anterior displacement of the spiral septum, it leads to tetralogy of Fallot. What happens here? So the ascending aorta is more wider compared to pulmonary trunk. here because the septum displaced anteriorly. So this transposition of great vessels, patent truncus arteriosus, tetralogy of Fallot, all these are neural crest cell defects. All these are neural crest cell defects. Okay, in the next video we will talk about development of interatrial septum. Okay, thank you.